Ladies and gentlemen, good morning, and thank you for the invitation to participate in the 24th seminar of the International Sugar Organization and to present WHO's views about the consumption of sugars. I apologize not to be with you today due to other commitments, but I would like to give you some of the information that we have used to base our recommendation. First of all, I'd like to start by calling your attention to the analysis done on the burden of disease in the world. A recent analysis indicates that dietary risk is at the top of the risk factors that are responsible for the burden of disease in the world. As you can see, over 11 million deaths are attributable to poor diet. We're also able to show that about 2 million deaths are attributable to child and maternal malnutrition, and that 4.4 million deaths are attributable to high body mass index. So clearly, nutrition factors have to be looked very carefully in public health policies. The WHO Global Status Report on Non-Communicable Diseases, issued last year, showed the updated estimates about the prevalence of obesity in men. You can see from this slide that the epidemic is certainly affecting the world with high income, particularly North America, Australia, but you see that increasingly countries with middle income are affected by this problem, and you should see particularly North Africa. And if you see the situation in women, this is even worse, with a part of Africa, and particularly South Africa, also affected by the epidemic of obesity. If we then look at the early occurrence of overweight already in children before 5, we see that the problem of overweight and obesity is a world problem, which is not sparing countries with middle and low income. WHO is looking at different factors that influence the epidemic of obesity and is doing this by using a very solid guideline development process. This slide just illustrates the steps of the process, and you can see that it starts by having certain committees established, and these are committees that are very carefully selected for their competence and independence from any competing interest. But the core of the process is the number 4, number 5, and number 6. So in number 4, you will see that formulating the questions that have to be addressed by the science analysis and by the panels is a key element. This step is also open for public consultation, so the questions that have been elaborated by the scientific panels are made public to get comments from all interested parties. Number 5 is the evidence retrieval, assessment, and synthesis, and this is done in a systematic way using, therefore, all the available science and making an assessment which is in line with what the systematic reviews methodology and journals like the Cochrane collaboration has been developing. And number 6 is the development of the recommendations that are also linked to the strength of the evidence with plans for updating. So these guidelines have an expiry date, and we update the guidelines when we have new information. There are also other steps which are related to the implementation of the guidelines and the evaluation of their impact. Coming to the topic of our conversation today, which is free sugars, I would like to quickly recall the previous WHO recommendation. In fact, the work on sugars dates back to at least 1989, when WHO working groups on diet, nutrition, and the prevention of chronic diseases produced a report that was indicating the need to keep the intake of free sugars as low to basically zero. So they were indicating a range of intake of free sugars between 0 and 10%. The science was then updated in a consultation jointly convened with FAO in 1997. And then we had a new expert consultation on diet, nutrition, and the prevention of chronic diseases in 2002. And this panel, this consultation concluded that free sugars intake should be kept to less than 10% of energy. Then this was followed by another scientific update and then by the guidelines that we have started to produce in 2013. As I told you before, the starting point of the work is the identification of the questions. And in this case, we looked at priority health outcomes for the guidelines. And the health outcome considered were, first of all, unhealthy weight gain. And this is in recognition of the rapidly growing epidemic of overweight and obesity worldwide. And also because free sugars contribute to the overall energy density of the diets. And so whenever we have an increase in energy density, also the total energy intake is increased. So clearly unhealthy weight gain is an outcome which is very close to the intake of free sugars. The other health impact is dental caries. And this is a very common condition, and the cost of the treatment places a heavy burden on healthcare budgets in many countries. This is uniquely caused by free sugars, and it's also a progressive disease. So it starts early in life and it continues throughout the life. So basically, at any stage of the life, the exposure to free sugars is associated with increase in dental caries. There are, of course, other important outcomes, particularly diabetes and heart disease. They are mediated by unhealthy weight gain, but we're starting to see the direct association between the consumption of free sugars and heart disease or diabetes. But that's not at the stage something which we decided to assess due to the amount of literature available at the time of the development of the guidelines. And I'm going to give you some facts from the systematic analysis of the science. We have analyzed together many studies in which adults have been put on a diet from a few weeks to a few months. And when the level of sugar was reduced in the diet, the body weight was decreased. And you can see here that the effect of having a higher sugar intake was associated to a substantial, systematic, and a significant difference in body weight. So higher sugar was associated to increased body weight. And this is the reverse. So studies that were looking at people who were increasing their intake of free sugars. You see here the studies have been divided into shorter studies, less than 2 months, and longer studies, over 2 months. And you can see that actually the difference in body weight increases, consistently with the hypothesis that, again, having a high energy density in the diet as a result of the consumption of free sugars was actually creating a higher energy intake. And the same story can be observed in children. So reducing free sugars in children was also leading to a decreased body weight. But here we have a complication because children were not as good as the adults to follow the diet and the advice. So the results are a bit less consistent, so they depend on how the children complied to the recommendations. And this is again a study in which we associated the intake of free sugars and the body fatness in children. In this particular set of studies, the sugar-sweetened beverages have been looked at, and consistently, children with higher intake of sugar-sweetened beverages were having a higher body weight. So this is a story about the body weight and unhealthy weight gain. The more the sugar, the greater the unhealthy weight gain. But this is also the story about oral health. And this is a separate study in which we analyzed core studies and the studies looking at these groups of children for some time were showing a positive association between the intake of free sugars and dental caries. And this type of studies also allowed us to give a number, to place a number to the safe level of intake, and particularly a higher rate of dental caries was observed at levels of free sugar intake of more than 10% of total energy intake. However, additional reduction of free sugars was showing even greater benefit. And we can say that based on a number of observational studies, population studies, in which the intake per capita was extremely low, was less than 5% of total energy intake, and dental caries was almost disappearing. It's important to know that the positive association between the consumption of free sugars and dental caries has been detected in all age groups, both children and adults. So the concluding set of recommendations coming from this analysis of the science was the guideline published by WHO early in 2015. It has basically three recommendations. The first one says that WHO recommends reduced intake of free sugars throughout the life course, and this is a strong recommendation. The second is that in both adults and children, WHO recommends that intake of free sugars not exceed 10% of total energy, and that's also a strong recommendation. But we also say that WHO suggests further reduction to below 5% of total energy, but this is a conditional recommendation. And a conditional recommendation is linked to the quality and the strength of the evidence, but it leads to basically a different response of the public health authorities. What is the difference between a strong and a conditional recommendation? In a strong recommendation, the desirable effects of adherence to the recommendation outweigh the undesirable consequences. So we're saying that the recommendation can be adopted as policy in most situations. Any guideline of WHO has to be adopted by the public health authorities in a country, but clearly a strong recommendation carries a very heavy weight, and most countries or most public health authorities in countries would be willing to adopt a strong recommendation. A conditional recommendation is slightly different. The desirable effects of adhering to the recommendation probably outweigh the undesirable effects, but these trade-offs could not be clarified by the evidence at our disposal. So policy making will require some debate and involvement of various stakeholders for translating them into action. So that's why we have a different status, a different strength of the evidence, and some space for independent decision making at country level. On the strong recommendation, we also would like to say that there are a number of policy options available for the implementation, which include food and nutrition labeling, consumer education, regulation of marketing of food and non-alcoholic beverages, high in free sugars, fiscal policies targeting foods that high in sugar. So this is in addition to clearly issuing food-based dietary guidelines. I'd like to highlight that on these guidelines we had public consultations. As I explained, there was a first consultation at the level of the definition of the questions, what we call the initial scoping. So we posted on the WHO website, proactively sent a call for comments through broad global mailing list, reaching out particularly to nutritionists and academia. We didn't receive many comments, indeed important comments from government agencies, institutions, academia, non-governmental organizations, as well as the private sector, including industry associations and individual companies. The draft guidelines was also made available through the WHO website to those who made a request for it and those who registered to make public comments. Probably as a result of the media briefing we gave at the launch of the consultation, we received many more comments. In this instance, we received 173 comments from, again, the same different constituencies that had responded to the initial scoping. We also had a peer review of the draft guidelines, and we consulted the members of the Global Network of Institutions on Scientific Advice of Nutrition, which basically brings together the different country institutions that are providing scientific advice domestically. We tried to cover all WHO regions, so all the world. We received a response from 6 peer reviewers. What we would like also to state is that the sugar guidelines should not be seen in isolation. They are part of the WHO recommendation for a healthy diet, which have been summarized in a fact sheet. And just the main points say that healthy diet starts from very early in life. We should breastfeed exclusively babies for the first 6 months and continuously breastfeed them until 2 years and beyond. We should balance energy intake with energy expenditure. We should keep total fat to less than 30% of total energy intake, shifting away from saturated to unsaturated fats and eliminating the trans fats from industrial processing. We should limit sugar intake as discussed. We should keep salt intake to less than 5 grams per day. And we should eat at least 400 grams of fruit and vegetables per day. But this is going to be updated based on our continuous work on association between diet and health. Clearly, there are policy implications for these guidelines, and the WHA, the World Health Assembly, has indicated that we should focus on 6 global targets for nutrition to be attained by 2025. The childhood overweight is one of them, so the target is to stop the epidemic of childhood overweight. And in the context of the discussion over non-communicable diseases, WHO has also established a global monitoring framework. And again, the rise in diabetes and obesity is something that the countries in the world have committed to stop. Last year in November, the second International Conference of Nutrition was convened by FAO and WHO in Rome, and the conference made 10 important commitments. And please note the number 7, particularly the commitment to ensure healthy diets throughout the life course. But this should really be done by not only informing the consumers appropriately, but by making the food environment conducive to accepting those recommendations. The framework for action associated to this outcome document was talking particularly about sustainable food systems promoting healthy diets, and that's certainly the challenge. So having foods that have the characteristics that are conducive to a healthy diet, having restaurants serving those foods, having supermarkets selling those foods, having producer making those foods. And that's what we expect to see from all the sectors and at all levels of the value chains to make sure that the recommendations for a healthy diet of WHO are seen as a guide for all investment and food and nutrition policies, for the benefit of health of the population and development of the countries. We have a Sustainable Development Goal framework for 2030, which is advocating for these very elements. So this is a big challenge, and we rely on your collaboration for its implementation. Thank you very much.